If you or someone you love is facing cancer, you may feel like you're suddenly living in a new language. Terms like immune system, immunotherapy, integrative oncology, and metabolic health show up in conversations, but it's not always clear how they fit together or what they mean for your day-to-day experience. I am Dr. Williford, and in this video, we'll walk through, in plain language, how your immune system seizes cancer, what modern immunotherapies are trying to do, and how integrative oncology and metabolic health support can work beside your oncology care, not in place of it. We'll look at practical areas you can discuss with your oncologist, whole food nutrition, stress and sleep routines, gentle movement, environment, and your metabolic terrain, and how those all connect back to metabolic health. We'll also show how SIE Medical's approach in Atlanta, Austin, Scottsdale, and through telehealth is designed to be collaborative with conventional cancer care. The goal is simple: to help you feel more informed, more supported, and more confident as you navigate your cancer journey. Let's start with your immune system. Every day, without you noticing, your immune cells are scanning for anything that doesn't belong: viruses, bacteria, and in some cases, abnormal cells that could become cancer. You can picture immune cells as teal circles on this slide, constantly patrolling and checking the ID badges of cells they encounter. When everything looks normal, they move on. When they notice something abnormal, they have the ability to mark those cells for removal. Cancer becomes challenging because cancer cells aren't just passive targets. Over time, they can learn how to hide from immune surveillance. They may change the signals on their surface, or they may send confusing messages into the surrounding environment, which we sometimes call the tumor microenvironment. On the right side of this image, you see a cluster of orange cells representing cancer. They're not just sitting there, they're interfering with the normal conversation between your immune system and your tissues. They can dampen the response, block the signals, or recruit other cells to help them stay hidden. The key idea here is that there is an ongoing interaction, almost a negotiation, between your immune system and cancer cells. That interaction is influenced by your overall health, your metabolism, your stress, your sleep, your environment, and your treatments. Understanding that dynamic makes the rest of the video much easier to follow. Now let's talk about immunotherapy, the group of treatments you may have heard described as releasing the brakes on the immune system. On the left side of this slide, you see a teal T cell facing an orange cancer cell with a clear break or block in between them. In real life, that break is often a checkpoint signal, a kind of molecular handshake that tells the T cell to stand down. These checkpoints exist to keep your immune system from accidentally attacking healthy tissues. Cancer cells can hijack these checkpoints. They can overexpress signals that tell T cells everything is fine, don't attack, even when something is clearly wrong. That's one way cancer hides. Checkpoint inhibitors, one major form of immunotherapy, aim to interrupt that false handshake. On the right side of the slide, you see the after image. The brake has been lifted, and the T cell is now able to recognize and engage the cancer cell. It's important to remember that immunotherapy is not right for every cancer type, and not every patient responds in the same way. Immunotherapy can also introduce its own side effects, such as inflammation, fatigue, or autoimmune-like symptoms. That's one reason integrative support, especially around metabolic health, stress, sleep, environment, and movement, is so important. It's about helping your body cope with both the disease and the treatment. Now let's zoom out and look at integrative oncology support. At SIE Medical, we think of this as a wheel, different areas that all connect back to how your body is functioning as a whole. In the wheel on this slide, you'll see 5 key segments: nutrition, stress, sleep, movement, and supplements. Together, they represent major contributors to metabolic health: the way your body processes energy, responds to inflammation, repairs tissues, and supports your immune system. Nutrition covers whole food choices, nutrient density, and how your eating pattern supports or strains your metabolism. Stress and sleep are deeply connected. Chronic stress and poor sleep can elevate certain hormones, alter blood sugar, and impact immune function. Movement doesn't have to mean intense workouts. It can mean gentle, safe activity that keeps your circulation, muscles, and metabolism engaged in a way that fits your current capacity. Supplements and targeted therapies are not one size fits all. In an integrative and metabolic model, they're chosen based on your labs, your diagnosis, your treatment plan, and your goals, with careful attention to potential interactions. The wheel reminds us that none of these areas exist in isolation. They're different doors into the same room. metabolic health, and whole person support. Because there is so much information online, it can be hard to know where to start. On this slide, we've highlighted three practical areas of metabolic health you can bring into conversations with your oncologist or care team. First, whole food nutrition. This is about exploring whole, nutrient dense foods and any targeted supplements that might help support healing, immune function, and overall metabolic health. You are a nutritional being, so most functions in your body are impacted by what you eat as well as how your body processes it. It's not about perfection, it's about small, realistic changes that can genuinely help your body. Second, stress and sleep routines. Stress and sleep are often overlooked, yet they can drive or calm many of the signals that shape your immune and metabolic environment. Stress can be driven from your environment, hormones, and lifestyle. Discussing stress management strategies and sleep support can contribute directly to resilience, recovery, and healthy regulation of your body systems. Third, gentle movement. Movement should be safe and sustainable. Even modest activity can support energy, mood, circulation, and metabolic well being. The key is tailoring it to your current condition rather than forcing a generic exercise plan. These three areas don't replace treatment decisions. They give you concrete topics to discuss to address your specific problems and options around what else can I do to support my body during this process. Integrative oncology helps when it is collaborative, not separate. On this slide, you see three connected cards: conventional medicine, SIE Medical's integrative and metabolic support, and the oncology journey itself. Our philosophy is that integrative care is a layer alongside your oncology plan. We look at your diagnosis, treatments, labs, and symptoms, and then ask what can we do from an integrative and metabolic perspective to support you more fully. That might involve nutrition, lifestyle medicine, stress, sleep, other strategies, and carefully chosen supplements, but always in the context of your existing treatments and individual plan. When integrative medicine, metabolic support, and conventional oncology communicate with each other, you're not pulled between competing opinions. Instead, you have a broader, connected picture of your care. On this slide, you'll see our locations and access options. SIE Medical provides integrative oncology and related services in Atlanta, Georgia, Austin, Texas, Scottsdale, Arizona, and also offers telehealth. Telehealth makes it possible for some patients outside of our office areas to access consults and follow up care. It's another way we try to extend integrative support to people who may not have local access. Wherever you are, the core message is the same. Integrative and metabolic support are meant to walk beside your oncology journey so you don't feel like you're navigating it alone. As you've seen throughout this video, the cancer journey is not only about treating the disease, it is also about supporting the person who is living through that treatment. Your immune system, your metabolism, your stress levels, your sleep, environment, and your movement all play a role in that experience. Immunotherapy and other treatments are powerful tools, but they're only part of the picture. Integrative oncology and metabolic support help fill in the rest, giving you more ways to care for your body and mind while you work with your oncology team. If you'd like to explore whether integrative cancer support is right for you, you can reach out to SIE Medical for an integrative oncology consultation in Atlanta, Austin, Scottsdale, or inquire about telehealth options if you're not nearby. Bring your questions, bring your treatment history. Our role is to help you understand your options, build an individualized plan, and walk beside you, not outside your oncology care, but alongside it with your whole person well being in mind. While we cannot discuss every detail in this video, you can find more on our webpage listed and may find more information in the video Metabolic Health and Chronic Illness on our YouTube site for SIE Medical. Thank you.